Yes, I have a question for you. My wife just had gallbladder surgery yesterday where they had her removed.
All right.
She was sent home today, so I'm trying to find out about her diet, what she needs to be eating and not eating, and any supplements that I can get for her to help with digestion.
Well, you're going to love this answer. Okay, Chris, it works a little something like this. Having your gallbladder removed is like somebody pulling your tongue out of your rear end. It does a major number on your gastrointestinal tract. So just about anything that she eats, just about anything that she takes in is going to cause her to, is basically going to cause her to get sick. Okay. Now, there are certain things that are going to make her more aggravated than others. In particular, she has to avoid things right now that are fatty. Okay, and you ease these into the system over about 6 weeks. So you don't want to have anything that's really heavily laden with fat. Okay, oils, pretty much the same thing. You got to go lightly with them. Why? Because the gallbladder, really, what its main function was a detergent reservoir. What it did was it kept bile salts into a little sack, okay, kept them in a suspended solution, and then would ease them into the small bowel in the event that you ingested something that had fat or oil. Well, guess what? Okay, it's no longer there. So the bile is going to trickle into the small bowel on an irregular basis. The hormones that actually cause the release of these salts into the small bowel now come directly from the liver. So it's going to take about a year, maybe more, in order for the body to regain certain elements of control. So the first thing that I would do would be to ask her to take small meals, nothing really big, but small meals. You do them every couple, 3 hours, 2, 3 hours. She takes something in. It can have carbohydrates in it, it can have protein in it, lots and lots of water, and expect her to tell you that her stomach doesn't feel so good. And that's the way it's going to go. Now, with regards to supplements, it's pretty much the same thing. Without having the bile salts in place, she's going to have a hard time digesting. So you have to supplement a bit more heavily now than she will later on. So it's going to be very, very important for her to be taking a heavy slug of the B complex. Why? Because she's not going to absorb them as well as she did before. So it's going to take more in order just to get the basics in there. The minerals, the chelated minerals in particular, are going to be hard for her to absorb. Iron is going to be hard for her to absorb. So you need to supplement these in particular. Now, essential carbohydrates are actually kind of an interesting thing, and they're often overlooked. When you sit back and talk to dietitians, when you talk to doctors in particular, when you talk to individuals that focus on the gut, they almost never mention essential carbohydrates. But after a gallbladder surgery, they're most important. So what is the most important of all of the essential carbohydrates? And it's something called galactose. Galactose is interesting stuff. So what do? You can find it in honey. Very inexpensive way to get this thing done. So what I would do, were I your wife, were I you, running out to buy the stuff that she needs to have, because you really want to let her rest. Okay, I would be buying a powdered protein supplement that contains the B complex and the mineral elements that we need. To that, you add a tablespoon of honey. Oddly enough, you do this in water, and you can add about a shot glass of olive oil, and that's just about enough of the fat, or oil really in this case, to get her what she needs. You do that once, maybe twice a day, and it's going to take care of most everything. And it's probably the least expensive way to get the job done. So whey protein is what you want to look for. Add a shot glass of olive oil, but make sure that you add a tablespoon of honey.